Hi everyone, I'm Dara Bergeron from Belly Bootcamp, and it's Whole Mama Wednesday, and I'm here today with Chana Ross. Hi, Chana.
Hi. Thank you for having me.
Yeah, I'm so excited you're here. So Chana is a pelvic floor physiotherapist working in Toronto, and she owns a clinic called Vital Physiotherapy, which is actually one that a lot of our Belly Bootcamp mamas come to, which is awesome. And Chana, you're at Vital Physiotherapy and Wellness on social media, correct?
Yes.
So you're on Instagram and
Facebook.
All right. So today we're going to talk about returning to running in postpartum and what happens to the body in pregnancy and postpartum and why running changes for a mama. So, Hannah, before we get into symptoms in pregnancy and postpartum, what happens to anybody's body when they run? So what happens to my younger sister who's never had a child? What happens to her body when she runs?
You're like, die,
I want a niece or a nephew.
The reason why running is this catch-all for it's high intensity exercise. Mm-hmm. So there is a lot of pressure that goes up through your joints and through your body when you're running, and depending on your gait pattern, how you run, your posture and alignment while you're running, how that is felt by the body is very different. So, when we're running, a lot of people will train you to lean forward and ensure that the joints are evenly receiving that pressure. But postpartum, because of the alignment changes, because of the inability of the pelvic floor to actually, and that whole inner core system to actually respond to running, very often that is a time where if there is weakness or poor coordination or poor flexibility in the system, we're going to notice it. Yeah. So sometimes your system's okay at lower intensities, but the higher intensity, the more that you're forcing it to work, the more obvious any kind of dysfunction becomes.
It's kind of like losing your shock system.
Yeah, exactly.
You're not absorbing it right, so you're going to take that shock, that impact into the wrong places. Or you pee. Lay them out for me. We should not be...
No, we shouldn't have any incontinence.
Yes. And that could mean front or back, because incontinence can include, you think it's a fart, and...
What do they call it?
Skid marks.
No, there's another word.
A shart.
Shart.
Sharts. Sharts and skid marks are not okay.
No, they're really not. And you know what? And there's nothing to be ashamed of, and that can be fixed. Any loss of urine, any pain with sex, back pain, hip pain, knee pain, all of the things that we associate with, I worked out too hard, are sometimes a sign that your core is not functioning optimally. Mm-hmm. And to be honest with you, are super simple to rehabilitate. We actually have an inner core that stabilizes our body and is our pressure system. So the four muscles that make up this core are actually your breathing muscle, your diaphragm. And your diaphragm sits underneath your ribs. So I will just angle this down a little bit. So your ribs are here. And your diaphragm is, I'll bring my head back into picture. So your diaphragm sits underneath your ribs. And in order for you to take a breath in, it actually contracts down as you inhale, and it creates a negative pressure inside your lungs and allows your air to be drawn in. And as you exhale, your diaphragm springs back up. Mm-hmm. So inhale and then exhale.
Right.
And it's met and it's kind of in synchrony with your pelvic floor muscle. They sit at the bottom of your trunk, okay, at the base of your pelvis. And all of your abdominal organs sit between your diaphragm and your pelvic floor, so that when you take a breath in, your diaphragm actually moves down. All of the organs inside push down, and they encourage your pelvic floor muscles to actually relax. Mm-hmm. And as you exhale, your diaphragm would spring back up, and that relaxes, and your pelvic floor muscles would engage. Mm-hmm. And they engage the two other muscles in your core as well, your inner abs and your inner back muscles. Inhale, exhale, inhale, exhale. And what happens is during pregnancy, each one of these four muscles is actually affected because
as your body changes, your diaphragm gets pushed up a little bit along with all of your organs to accommodate the growing baby.
Mm-hmm.
Your inner abdominals and all of your abdominals actually get stretched out, and the tissue between the abdominals gets stretched out as well. Your pelvic floor muscles, which you're used to kind of holding, I don't know, let's say 20, 30 pounds, are now taking an extra 20 to 60 pounds, roughly.
Right.
No judgment. Whatever happens during your pregnancy is your pregnancy.
It's just
but
extra weight.
It's extra weight, and so it has to work a lot harder. Okay. In addition to all this stretching and extra work that these muscles have to do, your posture actually shifts in order to not fall on your face as your belly grows, right?
Totally.
So what most women do is they take their pelvis and they tuck it under. So I don't know if this is your experience, but a lot of moms come in, they're like, I used to have But they do that because they don't want to fall forward, so they lean back and tuck under. So their whole upper back kind of leans back, and they tuck their bums under.
And that pulls the baby inward towards the center. And one of the reasons I got into like a lot of the body image stuff that I work with now is because I found body image affects women's alignment in postpartum. And so being self-conscious of that postpartum belly will have a lot of women, I think, still tucking under and sucking in even after the baby's gone.
Yeah. I mean, this is
not gone. Hopefully nobody took the baby. But after the baby's out, I mean.
What I will say is along the way, at some point during all of our lives, we have either received we explicitly received this message or subliminally received the message that we should be sucking in our belly all the time, and that we should be giggling and our pelvic floor should be tight because, our partners like tight pelvic floors. And so what we see very often postpartum is, you're right, like nobody's taught women how to come out of that alignment.
Let go,
Right? They're holding in their bellies, but you know what? They're also holding in their pelvic floor.
Yeah, totally.
Actually, your glute muscles, their job is to extend your leg behind you. Okay, so it's to move your legs backwards. I'm sitting down and lounging while we're talking, so I can't actually show you.
Our glutes are shut off right now.
That's right. But just take my word for it there, okay?
Generally, they're important.
So if you're tucked under, what it actually does is it limits your ability to actually bring your leg behind you. So your glutes are like, all right, folks, we'll see you tomorrow. Like they're just check out of there. And you know what? Your glutes are a major muscle group when it comes to running. Number one. Number two is when you're tucked under, your pelvic floor muscles actually there's 3 layers. The very base layer of the muscles is actually closer towards the front of the pelvis. So when you're tucked under, you're actually sitting so that the back of the pelvis is lined up with the floor. So you have less support on your pelvic floor when you're running in that position.
That's a good point.
And also, it's a position where your pelvic floor muscles tend to be super, super tight.
I think a lot of women get back into running earlier than they maybe should, and maybe even earlier than they really want to, just because they have this association between running and fat loss. And so they assume that running is the route to returning to the body that they had before they had a baby, which we know is so not true. You have to run so much to burn off calories.
I think people also return to running because it's something from their life before.
Yeah,
do you know what I mean?
100%.
It's also like it's not even just not always about the fat loss, although very often like getting your body back. We can have a whole other discussion about that terminology. Also, one of these days, not my favorite. Let's just say that.
Totally.
But it is, it's a way for people to kind of get back to the part of the life that they had before.
I think a 5K, a 10K is plenty of running for any mama. Who has time to train for a half marathon or marathon?
I've done it.
You have.
It's very time consuming.
It's a lot of time. It's a lot of time.
To not have 3 kids at a time.
Exactly. And I feel like also training for half marathon, sometimes just doesn't allow enough time for all the auxiliary work, like the strength training and the core training that needs to come with it. So if you only have 4 hours a week, you're going to spend all 4 hours running and no time working on your glutes.
And then you're setting yourself up for an injury there.
Exactly. So I think it's super important just to be like really kind with yourself and try to be accepting of the changes in your body and to support them with the best alignment and the best, I know alignment's super important to you, with the best alignment and the best support from people like physiotherapists, trainers, and coaches who make you feel good about your body so you can be strong and empowered, right? Rather than feeling like you've got to hide. So Chana, what about those pro athletes you see who are running at 9 months postpartum, or back to training, and the babies are 4 or 6 weeks? I feel like sometimes our moms think that they should be able to keep up with that standard. And how do you explain the difference, like between that person and the average mama?
Number one, high-level female athletes have a very high incidence of pelvic floor issues.
Oh, good point. Totally.
So next to our prenatal and postpartum moms, that's the next largest group of people that we see. And so, like, who knew that, right?
No, and who's to say they're not having symptoms when they're doing this training, right?
To be honest, people are not really talking about it. I talk about it. You talk about it. But, just because somebody's not telling you that they're experiencing symptoms doesn't mean they're not. So I just want to be very clear about that.
That's a great point.
And number two is, who is saying that these athletes are not tapering down? If they were working out at extremely high levels pre-pregnancy, they're just, what they think is a lower level or a kind of like a rest and a return to exercise level might be your super intense workout day.
Yeah.
Just the level that they're used to working out at, and how they work out, and what their body is able to do are very different than you and I. Like, I go to a spin class and I'm like, who allowed this woman in here to do this?
Yeah, it's true. That's right. And you don't know if this is just a snapshot of them, with intense training phase, but maybe they're just doing some short intervals or, some low tempo work or something that for them is the equivalent of, for us, going for a speed walk or something, Good point. So Chana, what do you recommend we work on in postpartum before we even think about running?
So we really want to get all of these systems functioning well. And the best way to do that is to get you aligned properly, because muscles and tissue works best when they're in alignment. So we're ideally looking towards getting your ribs over your pelvis, teaching you how to return, actually educating you on how to breathe again, because postpartum, it is a totally different body. So how, most of our ladies are breathing up here, or they're pushing into their belly to make it happen. Actually educating people on how to breathe properly so that their pelvic floor can release. From my perspective, the most important part for stability is actually your inhale.
Yeah.
You got to go to inhale. You have enough time on your exhale to actually focus on activating your pelvic floor. And
Great point.
Thanks.
But not that shallow kind of, shoulders in your ears breathing that I think a lot of moms struggle with, because they're just so tight up here even, you know what I mean? Not to mention the pregnancy symptoms, but just like so much tension, right?
Breathing is a basic for function of living. And the best way to ensure that you're in good posture is to find a breath where you get the most amount of air with the least amount of effort. It should just be easy. And very often if we can just get ribs over pelvis in certain positions, or just has a ski jump position where you're kind of arcing from your ankles and standing, you just kind of lean forward. Yep. You can remind your body how these postures worked well, because you're getting more oxygen, so we want to work out in those positions.
Exactly.
We start off lying on your back, breathing, teaching this whole system how to work, activating the pelvic floor at the right time. But then you know what? We can only do that for so long. We need this to be functional. Once we get you to a point where you can do your breathing, you can engage the system, you can do it in standing and seated and all positions, then basically we do like a couch to 5K. Like, we treat you like you have never run before. Yeah. And we teach you what to think about as you're running. You want to do it in a way that you can move forward without being like, am I ready, am I not? Like, you want to know that I got this, right?
That's a great thing. So you need to have that feeling. If you don't have that feeling, then you probably need to take it back a couple notches till you have that feeling again.
Yeah,
so,
1,000%.
And as you said, leakage is leakage. So when moms come to us and they'll say, oh, I don't pee when I jog, but I do pee when I like cough or sneeze or laugh. And we'll tend to say, if you leak at all, we don't want you to be running yet.
We want our clients to know that their bodies are strong, they are powerful, they are resilient. Sometimes strong, powerful, resilient bodies need a little bit of rehab, and that's okay. It doesn't mean you're not strong, powerful, and resilient. So what we do is we take them to the very end of their capabilities before their symptoms come on. So you want them to do everything they want to do as long as they're symptom-free. And then we keep kind of pushing that line. We want them to keep working a little bit harder, a little bit harder, a little bit harder, so that they feel like they're making progress. They can see that every time they take that next step forward, that they're like, I've got this.
You're so pro-exercise, so pro-activity. I think that's what makes for a really good relationship with a physiotherapist too, is someone who's supporting the things you want to do. As you said, not just saying, this is out, that is out, this is out, you know? What are some exercises that you can do if you're still having symptoms when you're running that can give you that kind of endorphin high, but will be less stressful on the pelvic floor?
So, I mean, I love spinning. Like,
I hate spinning.
No, yeah, me too.
You love spinning for other people.
Yeah,
that's an important distinction. Now we can be friends again.
Love it because it gets you that endorphin high.
Yeah.
It's really hard, but it also can get you that higher heart rate without the impact on your pelvis. That's number one. Number two is there are ways to run while minimizing the impact. So down the street where I am, I have a great relationship with a clinic called the Runners Academy, and they actually have a gravity-eliminated treadmill there, which you get zipped into it. You wear like this really cute tutu. It's not as cute as it sounds. And you get zipped into the top of the treadmill, and it's basically like you're in a balloon. They pump it full of air so that it reduces the amount of your weight essentially as you run. So you can basically go for a run and reduce the impacts that you're through your body. And as you get stronger and stronger, you can reduce the amount of air that they're pumping in. So you're doing 80% to 80%, 20%, 40%, whatever you need at that time.
So that's great for those who are really serious about their running careers and looking to return to that, like more like either to racing or longer endurance runs. That's really great. I didn't even know that existed.
The other thing that I really love is it's walking on an incline. It's simple, easy, but you can get that heart rate up, and it's really hard. I would actually choose spinning over walking on an incline personally, but
I mean, if you had to do one or the other, I would always choose anything over spinning. That treadmill sounds awesome. We like inclines at Belly Bootcamp when we get to use them, which is only outdoors, because it also helps our moms to do that bum untucked position that you were talking about, and kind of forces them to bring their ribs down over their hips. So, Chana, how do we know then if we should see a pelvic physio before we start running?
My general rule of thumb, completely objectively, of course, but is that anyone who's ever had a baby should be assessed by a pelvic physio.
Right.
Sometimes you don't know. And with things like prolapse, when your organs are not where you think that they are, which is, if you're feeling heaviness in your pelvic floor, you should also be running. But sometimes they're symptom-free, and with prolapse, it's really important that you strengthen your pelvic floor before going to start a running program. A lot of women don't actually know that they have it. So my rule of thumb is everybody should get assessed.
I think that's great. And we can definitely vouch for that we'll have women come to class who maybe are a few months postpartum already, and they think they're symptom-free because they haven't tried anything yet. And then once they come, they're like, you know what, I did pee a little bit, or what have you. So, yeah. So Chana, everyone can find you at Vital Physiotherapy and Wellness. And your website again is?
VitalPhysiotherapy.com.
And I know that you do lots of events for pregnant and postpartum mamas in Toronto, for anyone who's in Toronto. And, of course, you see patients in Toronto. But you've also got really good stuff up on your social media, and you do lots of free sort of webinars on Facebook all around these kinds of topics. So hopefully people will find you there.
Okay, I look forward. Come, say hi, and thank you very much for having me.
Thanks, Chana. Bye.
Good day.